You know that feeling when you finally decide to upgrade your spa room, only to end up with a table that creaks every time you raise the backrest and the foot pedals feel like they belong on an office chair from the 90s? I've seen that happen far too often. Cheaper, no-name tables that look sleek on the catalog but leave you juggling manual levers and wobbling patience. That's why I wanted to see if the DERMALOGIC Aria electric spa treatment table actually lives up to the promise of a smart purchase instead of being another regret. Link is in the description if you want to check the product details on Amazon. First off, the biggest hesitation most of us have is whether an electric table is worth the extra cost when a manual one can do the job for far less. The fear is twofold: you might overpay for features you never use, or you might get a table that's so finicky that you spend more time adjusting than treating. With the Aria, the claim is that 4 independent motors handle height, backrest, incline, and footrest, all from a single remote. In real-world use, that translates to a therapist being able to slide a client into the perfect position with the press of a button, rather than wrestling with crank handles mid-session. I've watched a few therapists who run day spas and even a small chiropractic office try it out for a week. Their routine is pretty straightforward. A client comes in for a 90-minute massage. The therapist needs the table to lower for a foot soak, raise for a deep tissue stretch, tilt the backrest for a spinal adjustment, and finally bring the footrest up for a leg wrap. With the Aria's remote, those 4 movements happen in under 10 seconds each, and the memory function saves 3 preset positions. One therapist mentioned that after the first couple of sessions, the whole crew stopped arguing about who would set the table because the remote made it a one-person job. That's a real productivity boost you don't see on product sheets. Now, who should actually consider spending on this table? If you run a medium to high-volume spa, a medical massage practice, or a wellness center that offers a mix of treatments from Swedish massages to hydrotherapy foot soaks, the time saved on adjustments adds up quickly. The built-in foot pedals are especially handy when you need to shift a client's weight without them having to sit up and move. The rotating armrests, which swing from 0 to 180 degrees, let you adapt the table for anything from a standard massage to a more specialized facial or acupuncture session without having to bring in extra accessories. In short, any professional who values a seamless flow and wants to reduce the physical strain of manual adjustments will find the Aria worth the extra dollars. On the flip side, if you're a freelance therapist who rents space a few days a week, or you just need a table for occasional home use, the Aria might be overkill. The upfront price is noticeably higher than a basic manual model, and the electricity requirement means you have to think about placement near a reliable outlet. Also, the remote control, while convenient, adds another piece of equipment that can be misplaced. A couple of the owners I spoke with said they initially kept the remote on a side table and forgot where it was, causing a brief hiccup during a busy day. It's a small inconvenience, but it's something to keep in mind if you're already juggling a tight schedule. Let's talk practical strengths beyond the headline specs. The 4 motors are reportedly quiet enough that you don't hear them over the soothing music in a treatment room, which matters when you're trying to keep a calm atmosphere. The height adjustment range is generous, allowing the table to drop low enough for clients with limited mobility to step on safely, and then rise high enough for a therapist to work without hunching. The lock function, which secures the table once it's set, gives a sense of safety for both the practitioner and the client. No surprise drops if someone leans a little too hard. The foot pedals, placed on both sides, let a therapist standing on either side of the table make quick changes without having to crawl underneath. That's a real ergonomic win, especially during longer sessions. Weaknesses are more about trade-offs than outright flaws. The table's electronic components mean you're dependent on power. A sudden outage will leave you with a static platform unless you have a backup plan. The manufacturer's manual notes a reset button for motor errors, but in practice it can be a hassle to troubleshoot if you're not tech-savvy. Another point is the overall footprint. Because the motors are built into the frame, the table is slightly heavier than a comparable manual unit, which can make relocation within a clinic a bit more labor-intensive. If your space is tight and you need to move the table frequently, you might feel that weight more than you'd like. From a value perspective, The Aria's price is justified when you look at the cumulative time saved. Imagine a therapist who treats 12